The application of fluoride varnish has become a routine dental procedure and an effective part of an overall oral health care program, including the treatment of dental hypersensitivity. Now there's a topical fluoride varnish that delivers 10 times more fluoride release than the leading varnish brand. This module will introduce you to Embrace Varnish from Pulpdent, a 5% sodium fluoride varnish with CXP for unsurpassed fluoride release. Embrace Varnish is value-priced and is available in convenient packaging designed for easy dispensing. The FB50 box contains 50.4 milliliter unit dose packets, and the FB200 box includes 200.4 milliliter unit dose packets. Embrace Varnish is a permeable resin-based varnish that contains 17.6% xylitol, sodium fluoride, calcium, phosphate, and less than 20% ethanol. When applied to the teeth, it releases fluoride, calcium, and phosphate ions. Xylitol has been reported to have an inhibiting effect on the growth of cariogenic bacteria. Fluoride, calcium, and phosphate have been shown to be beneficial to tooth structure. By incorporating xylitol-coated calcium and phosphate in a permeable resin matrix that does not separate, Embrace Varnish offers a sustained, time-release varnish that delivers 10 times more fluoride than the leading brand. Here's how it works. The xylitol coating prevents the calcium and phosphate salts from reacting with the fluoride prior to exposure to saliva. As a result, the calcium, phosphate, and fluoride are bioavailable in the mouth and provide all the benefits of fluoride varnish. Once applied, the saliva in the mouth dissolves the xylitol, releasing the calcium and phosphate ions. These ions react continuously with the fluoride ions to form protective fluorapatite on the teeth. Thanks to its unique formula, Embrace Varnish delivers sustained fluoride release on the teeth for the anticipated 4-hour treatment period. In a study of 5 leading fluoride varnishes, the Dental Advisor Biomaterials Research Center evaluated the release of fluoride ions over a 4-hour period. The study showed that Embrace Varnish produced a significantly greater amount and rate of ion release than the other varnishes. Here we can see that Embrace Varnish clearly outperforms the competitors in cumulative fluoride release. In addition, the rate of fluoride ion release for Embrace Varnish increased at a significantly higher rate over the 4-hour period than the other varnishes, producing an ever-increasing amount of fluoride ions during the length of the study. The other varnishes exhibited a diminishing rate of release after 1 hour, at which time they transitioned to a low release rate. Embrace Varnish was also the only varnish tested that did not separate while on the shelf and did not have to be mixed. There's a lot more to like about Embrace Varnish than fluoride release. In addition to delivering a predictable, uniform dose over 4 hours, the varnish is easy to apply, spreading to a thin film without clumping. It has a smooth, non-gritty texture that sticks to the teeth and not the cheek. It flows readily from the buccal to lingual surfaces. It contains no gluten or soy-based products, and it has a pleasant fruity taste to help ensure patient compliance. Embrace Varnish is effective for treatment of hypersensitivity. The sustained, timed release of fluoride, calcium, and phosphate ions occludes dentinal tubules and fills superficial non-carious enamel lesions, helping to reduce sensitivity. To apply Embrace Varnish, dry the teeth with a gauze pad. Ideally, the teeth should be minimally clean, but prophylaxis is not necessary. To open the package, tear at the slit on the right side and remove the brush. Pinch the pouch at the left side to push the contents back from the tear line and tear at the slit to open the varnish pouch. Dispense a small amount of varnish on your glove or a pad. Pick up the varnish with a brush. With one horizontal swipe of the brush, apply only as much varnish as necessary to cover tooth surfaces with a thin film. Each unit pack contains 0.4 milliliters of varnish. However, it is not necessary to use it all. Only use enough varnish to apply a thin film on the desired treatment area, taking into consideration the weight of the patient and the number of teeth to be treated. Patients should avoid eating hard foods and drinking hot liquids or alcohol for 3 to 4 hours after treatment, and should not brush their teeth for at least 4 hours. Adult patients should refrain from taking prescription fluoride supplements for a period of 24 hours following treatment, and children should refrain for 2 to 3 days. Many of your patients can benefit from fluoride varnish treatment. So why not use the varnish proven to release 10 times more fluoride than other leading brands? Embrace Varnish is easy to apply. It releases bioavailable calcium and phosphate ions, which are essential building blocks of teeth. The formula requires no mixing and doesn't separate. It offers an effective treatment for hypersensitivity. And it delivers a predictable, uniform dose over 4 hours for maximum fluoride effectiveness. To improve your patient's oral health, make Embrace Varnish from Pulpdent a part of their overall oral health care program.